Week 6, Patient Engagement. In the beginning of the class, you learned how the Institute of Medicine, or the IOM report, recommend electronic health records. In the 1991 publication To Err is Human, the IOM recommended that patients be involved with their healthcare. Involving patients in their healthcare increases health outcomes, improves patient satisfaction, and is key to patient adherence. This week, you're going to learn how to engage patients in their healthcare through the use of data and information. Taking care of patients on the floor, we involve our patients in their care through our explanation of various diagnostic tests, plan of care, and meaningful discharge goals. But what is patient engagement? Carmen et al. In 2013 defines patient engagement as patient, families, their representatives, and health professionals working in active partnership at various levels across the healthcare system, direct care, organizational design and governance, and policymaking to improve health and healthcare. The advancement of technology and legislature involving patients and their care have become much easier. Some of the meaningful use criteria include patient engagement, whether it's getting an electronic copy of their discharge instructions, health information, or to view their health record online. The word e-patient was coined by Dr. Tom Ferguson. These are individuals that are equipped, enabled, empowered, and engaged. That's on epatients.net, no date. He developed the Society for Participatory Medicine to support patients to becoming active partners in their healthcare. E-patient Dave, or Richard Daves Bronkhart Jr., is a cancer patient who's been an activist after he was diagnosed with kidney cancer back in 2007. Ever since then, he's been blogging, transforming healthcare through participatory medicine and personal health data rights. In 2011, he gave a presentation on TED Talks about his journey. Today, he teaches at the University of Minnesota School of Nursing on patient engagement and health IT and speaks to audiences around the world. You can also find him on Twitter, Facebook, and LinkedIn. And this week's assignment, you'll be listening to his TED Talk. Here are some technology tools to engage patients on wearable technology. How do we engage patients in healthcare using data? Chris Edwards in 2015 talks about involving patients in their healthcare through the use of technology. There are increasing number of health apps available to patients to help monitor their health, like weight, diet, and exercise. There's also been an increase of wearable devices for patients to track their health and biometric devices. The first wearable device was designed by inventors in the 1960s and 70s to help gamblers cheat in casino. This was first published by Knobloch in 2014. Gross in 2014 also reports that the number of wearable devices will be on the increase, with the number of shipped products of 13 million in 2013 to 130 million in 2018. Dr. Skiba talks about the connected age is all about being connected to resources, people, devices, and even to oneself. Wearable technology like Fitbit, Jawbone, or even the Apple Watch helps patients become more connected to health. It makes users more accountable for their health if they can actually view their progress. Patients who track their activity tend to sit less. A patient portal is another tool that helps to engage patients by giving them access to their medical record. This is usually a secured network that allows patients to access their medical record 24/7 to see upcoming appointments, results from diagnostic tests, and other health-related information. This is also a meaningful use stage 2 criteria to provide patients the ability to view online, download, and transmit their health information within 4 business days of information being available to the eligible professionals. And that can be found on healthit.gov. The system or the electronic health record maintains the patient portal. The great thing about patient portal is that patients can look up their recent lab results, ask for refill of their medications, or request an appointment. Some of the key features to make patient portal successful are provider endorsement and continued engagement with patient regarding the portal. A patient or personal health record is similar to the electronic health record, except that the patient maintains it. This is a private, secured, and confidential environment in which the patients can store health information. Patients can access their record 24/7. In a study by Drew Zoe, Click, and von Enzenwerk in 2014 showed that mental health patients who use electronic personal health record had a significant use of medical services and increased quality of care. This is a vulnerable population and benefit from using a low-cost technology tool to improve health outcomes. Telemedicine is a medical information that is shared through electronic communication from one site to another. For example, a hospital in Alaska might send radiological images to a provider in Virginia for a second opinion. You might have heard of the doctor at the South Pole who diagnosed herself with breast cancer. Dr. Jerry Nelson discovered a lump in her breast when she was stationed at the South Pole in Antarctica. Since the weather was so severe, she could not get out, so her and her colleagues got creative to help diagnose the lump. With her colleagues' help, she took a biopsy of the lump, was able to send the tissue samples via the internet to a pathologist in Indianapolis, Indiana. Telemedicine is very helpful for rural communities to get help from industrial cities throughout the country that have more specialists. Some rural hospitals rely on teleradiology to get urgent studies like patients who have had severe stroke or traumatic injury to get diagnosed. Weinstein and et al. In 2014 states that some of the challenges of telemedicine include reimbursement for services, interstate medical licensure, and hospital licensure. Over 900 million people visit Facebook every month, making it the most popular social media site. Social media is not just for grandparents trying to keep up seeing updates from their sons or daughters about their grandkids anymore. Hospital, health networks, providers are now signing up with social media to connect with their patients. Institutions usually have more than one social media site like Facebook, Twitter, LinkedIn, Instagram, YouTube, Foursquare, and blogs. One practice in New York uses social media so that patients can see profiles of their providers on Facebook. Patients can sign up for this practice called Hello Health for a basic enrollment fee of $35. This is a private practice with over 300 patients who signed up in which your health insurance is not billed, but instead that they have you try to submit a claim, rather than bill you directly for the fees. But if you have a cold or stubborn cough, you can just get an instant message to the provider to get help or a guaranteed appointment within 24 hours. This was provided by Hahn in 2009. It is estimated that over 67% of all internet users use social media to find health-related information. By Hazel et al. In 2014, they state approximately 1,229 hospitals use social media to engage their patients. A few of the studies reviewed found benefits for patients when they use YouTube to view health-related topics. The patients tend to be more emotionally involved with the videos, and it helped with patient literacy. Another study showed that the benefits of Facebook, including community building, accessibility, and inexpensive. Sites like Patient Like Me shows the patients are interested and want to be involved with their healthcare. This is a site in which patients can sign up for and find other patients with the same disease. They can chat with others to see how they deal with their disease. Over 350,000 members have joined this free site that is accessible 24/7. Another site called Caring Bridge is a website that patients can create their own personal website to blog about their healthcare journey and their disease process. This website allows the users to ask their community for help with meals or just update them about what's going on with. Let's talk about evaluation of digital tools. The first topic is health literacy. Technology tools can help patient engagement, increase health outcomes, and become an active partner with their provider. Before we give patients any tools, we should assess their health literacy. Health literacy, defined by Sengsak and Boise in 2015, is the ability of the patients to receive and understand provided health information from clinicians' instructions to disease-specific information on page 326. Health literacy is more than just patient reading written material. It includes patients able to follow directions and understand the material that is given to them by their healthcare providers. Patients with low literacy have poorer health outcomes, tend to hospitalize more, and have higher mortality rates. One of the more common tools to assess health literacy is the shortened test of the Functional Health Literacy in Adults, or the STOFLA. This test can be given to patients in about 7 minutes that assess their reading comprehension and numerical ability. They have English and Spanish versions available. Health.gov also has excellent resources for providers and patients to improve health literacy. They can give an overview on how to assess patient education that is given to patients to make sure it meets the basic for health literacy. We want patients to engage with their health through technology, but we also want to make sure that what we give patients is accurate and usable. When a patient wants to know about a rash they're developing or to look up their lab tests and what they really mean, we want a website that is updated with the latest information. One of the things to look for a website is that it's been updated on a regular basis. We want patients to engage with health through technology, but we also want to make sure what we give patients is accurate and usable. When a patient wants to know about Ever since Apple came up with mobile apps, the number of apps have grown to 1.5 million apps in the Apple Store. The number of mobile applications, or mHealth, have also dramatically increased over the years. The Arizona State Library developed a tool to help evaluate health apps since they are currently not regulated by the government. They created the acronym of ABCUS, for you to evaluate apps using the framework. This stands for accuracy, bias, authority, currency, usability, and scope. Using this tool to evaluate apps will help you differentiate the correct apps to give to patients. And this is also a link for you guys to take a look at up on the website. Usability. When we give any new digital tools to patients, we want to make sure that they can use it. Usability is defined by the Technology and Informatics Guiding Education Reform, or TIGER, defines it as the extent to which product can be specific context to achieve specific goals with effectiveness, efficiency, and satisfaction on page 4. Effectiveness is the tool useful. Does it function properly? If you click on a link to a website, does it open up or does it give you an error? Efficiency is the learnability of the tool. Is the tool easy to learn? Can you figure out how to post a comment or a picture on the tool? The last part is satisfaction, which is the direct result of the product being effective and efficient. Health technology helps to engage patients, but with any new tool, we want to make sure that we not only assess the patient's health literacy level, but also assess the tool that we give them. As providers, we need to make sure that tools are easy to use, accurate, and will provide patient satisfaction. We need to make sure that we stay up to date with the digital tools and the product we give to our patients. I hope you have a great week.